have Dr. Mehnaz Hyder. She's a physician. Yes, she's a physician, a psychiatrist who's double board certified in both adult and child psychiatry. She's been practicing for 12 years.
Considering we're in the midst of a deadly pandemic, you would think that the government and the healthcare industry would be doing whatever they can to support and strengthen the doctor-patient relationship, right? What if I told you the doctor-patient relationship is under attack by corporations and politicians, both of whom stand to lose nothing if they make reckless decisions about your health? They don't have skin in the game of your health. If you look a little closer at how this industry works, you'll see that it's based on billing codes and actually designed to be expensive and very hard to understand. Because the higher the costs, the more dollars the organizations capture. So whether or not you get the complete care you deserve, they get paid either way. They operate by inserting themselves into the doctor-patient relationship, which is supposed to be sacred and supposed to be based on trust in a doctor's ethics and extensive training. Instead of you and your doctor, the administrators get to dictate all of the terms. You deserve all the ethics and training because you are the one that has the most to lose when bad medical decisions are made on your behalf by insurances and hospital administrators. Is this what our healthcare is supposed to look like? Aren't you supposed to be at the center of your medical care? For years, administrators have put limitations in place to deliberately erode this trust for their own benefit. They want to devalue the role of your doctor so that they can take even more control over your health and therefore dollars. Doctors have to undergo decades of intense full-time study of medicine, thousands of hours of specialty training, and pass countless hurdles designed to weed out even the ever so slightly underprepared. Because the stakes are high. It's literally your life. Okay, so the state of California is ensuring that we get the highest standards, right? Well, no. The California Legislative Assembly is currently in the process of actively dismantling your right to the highest standards of care. The very titans of the healthcare industry that gave us the broken system we have now have backed a bill that allows for the independent practice of medicine by non-physicians who have never stepped foot in a medical school, let alone completed the additional and necessary training of an accredited residency program, but they're still calling their education and training equivalent. Conveniently, hospitals and clinics will no longer have to guarantee a doctor's involvement for the care of every patient. You know who has the most to lose from shortcuts in education? You do. If medical school and residency were extra and unnecessary, wouldn't we as the physicians have gotten rid of them ourselves a long time ago? We're the ones who have to do the training. Would we put ourselves through a decade worth of extra training if it was unnecessary? We do it because we know for a fact that patients deserve nothing less, and that the intensity and depth of education, because we know all the dangers of what can go wrong. Well, sometimes that depth of education clashes with billing. But what about access to care in rural and underserved areas? Well, just a few months ago, California added more years of direct physician supervision for the doctors to get independent practice. In one stroke, they vanished thousands of medical residents who until now were working, ironically, in rural areas. So, is this really about access to care? Your government can stop playing bodyguard for corporate interests. Patients can have both access to care and have a physician-led team with the highest level of expertise if the politicians just get out of the way. It doesn't have to be either or. Patients, you have the right to start asking about who's really behind all the limitations in your care. You have the right to ask for a doctor. Your destiny, the destiny of your health, is in your hands. Thank you.